Now demonstrate local anaesthesia of the paralumbar fossa here. This is commonly done in preparation for surgery in the standing cow prior to abdominal surgery. This is a common procedure in cows. It could be a caesarean, although that would be done on the left-hand side of the cow. Often we do an exploratory laparotomy from the right-hand side of the cow, or we do a laparotomy to correct abdominal displacements of organs in the abdomen. Now, there are different ways to prepare the cow for surgery using local anaesthetic. The normal incision is about 1 hand's breadth below the transverse processes of the lumbar vertebrae and about a hand's breadth behind, or a little bit behind, the last rib here. So we need to make an incision about this long in the abdominal wall through the skin and muscle layers. So we can do a line block where we infiltrate local anaesthetic in a line, first of all under the skin and down through the muscle layers, and the cow hopefully will not feel anything as we're doing our surgery. The disadvantage of that is we have local anaesthetic infiltrating right through the space where we're doing surgery. Not a big problem, but not ideal. Another way to anaesthetise the area is to do what we call an inverted L, where we place a line of anaesthetic horizontally just underneath the transverse processes and then down behind the last rib. First of all under the skin and then deeper into the muscle layers. Because the spinal nerves leaving the spinal cord are travelling in a direction like that, posteriorly, as we anaesthetise here, doing an inverted L, we'll block those nerves and be able to proceed with surgery. But perhaps the best way of all is to do what we call a paravertebral nerve block and anaesthetise the nerves as they leave the spinal cord up here. This has some advantages. It completely anaesthetises all of the layers, the skin, the muscles, and the peritoneum, and it can be done even more quickly than these other methods. That's what we'll demonstrate here. The nerves that we block are T13, L1 and L2. The thoracic spinal nerve number 12 or 13, and then lumbar spinal nerve 1 and 2. The way we find the correct spots, we have to remember where they run, and we do that by looking for the edges of the lumbar transverse processes. Now in a cow, we can usually only feel, there are 6 lumbar vertebrae, 6 lumbar transverse processes. We start at the back. Number 6 is up here towards the tubercocci, and you cannot usually feel the end of it. So the first one we can feel, which I can feel here, is lumbar vertebrae 5, transverse process. Here's number 4, working forward. Here's number 3. Here's number 2. And in a fatter cow, it's like this cow, she's getting a little bit more condition on her. I can just feel the edge of number 1. I want to inject in front of lumbar vertebrae transverse process number 1, behind transverse process 1, and behind transverse processes 2. So in front and behind 1 and behind 2. So I visualise where I want to inject. I then proceed to clip the area very quickly. I've got behind 1 and behind 2, so I don't need a very big area clipped. This is one of the first things I do in preparation for surgery. I disinfect the area fairly well. Just reminding myself where that's number 2. So number 1 must be back here and right at the front of my clipped area there. Cleaning and disinfecting. My first step is going to be to place a bleb in each of those 3 spots. And I'll start with the one most posteriorly. And I'll get an assistant to apply a tail jack, because even though this cow's a quiet cow, when I inject through that skin and muscle layer, then I'm most worried about that right hind leg lashing out and coming over the top of this gate. And so I'll stand fairly well forward, and I'm going to I'll start at the back really. I'll start at the most caudal spot, and the transverse process is running here. And I want to inject about 3 or 4 centimetres from the midline, about a matchbox length, just behind lumbar vertebra number 2. So I'm going to put a bleb in under the skin, but I'll do that by quickly jabbing the needle perpendicularly in and then injecting the local anaesthetic as I withdraw the needle and end up with a bleb under the skin. So plenty of pressure on that tail jack, please. And then a quick jab in like that. Cow didn't jump too much, but I'm being cautious. And I inject as I come out and put a bleb particularly under the skin there. I then do it that's behind L2. I'm going to go behind L1 here, about that spot there. Plenty of pressure on that tail jack, and quick inject again. Being very cautious here, it's a bit painful for the cow. Quickly trying to put a bleb in there and putting a bleb under the skin as I come out. And then having another look now in front of L1, my third and last bleb, plenty of pressure there and quick injection. And the cow doesn't like that too much, so I must get some local anaesthetic in there pretty quickly and inject. You can see I have to take some precautions. I've now got 3 blebs. I now take a spinal needle, a fairly long spinal needle, 10 centimetres. I think I'll still keep the tail jack on. I'll ask my assistant to stay there with the tail jack. I'm going to go down through the bleb this time. Hopefully the cow won't feel quite as much this time. I'm going to go perpendicular through my bleb. I'm going to angle just a little bit forward so that I hit the transverse process. So I've hit the transverse process, and I walk off the back of it because I wanted to go behind it, and then just go down until I feel it pop through the ligament there. And I will inject about 15 mils of local anaesthetic just below the lateral process of that lumbar vertebrae, moving it up and down around that spot, putting in about 15 mils or so. And then as I bring the needle out, I make sure that I put a little bit right on top of the vertebrae as well, of the transverse process. So that's the first one done. Another 20 mils of anaesthetic, 25 mils of anaesthetic. And this time I'm going to go through my bleb behind L1, about that spot there. Plenty of pressure on that tail jack again, easing down, hitting the transverse process, walking off the back of it, and then popping through. Fairly quickly, putting in some anaesthetic there, about 15 mils just below the transverse process, and as I come out, put a little bit on top of the transverse process as well, all around, mostly underneath, but a little bit on top. And there's just one last one to do. Another 25 mils of local anaesthetic, and this time we'll go in front of the transverse process of lumbar vertebrae number 1, which is blocking T13 nerve. So out we come again. A little bit harder to feel the end of L1. Back here where I put the bleb, hopefully she won't feel too much as I go through that bleb, through the skin, down, and I can feel the bone. I now want to walk off the front of it. There we are, walking off the front and just popping through the ligament that joins. I usually draw back and make sure that there's pressure drawing back and inject there. If I go too deep, I could be right into the abdomen, and when I draw back, it might suck air back in. So I make sure that I can't suck any air back in, and make sure that I haven't gone too deep by just checking that there's resistance when I draw back, and then inject both below and above the transverse process. We've come back now to check if our paravertebral nerve block has been effective and to check whether this whole paralumbar fossa area here has been anaesthetised. There are three ways to check. One is, first of all, the skin over this paralumbar fossa area here, often, especially after it's clipped, often feels a little bit warmer than the other side or other parts of the body because the blood vessels have dilated and there's extra blood flowing, and this is a warmer spot then. The second way to check is to take a needle and to prick where we're going to do the surgery. And of course, if it's anaesthetised, loss of sensation, we should have very little reaction from the cow. And so we should be comfortable now to prepare the area for surgery and do surgical incisions through the skin and muscle layers. You can see here very little reaction, whereas if I move somewhere else on the body, I'm sure there'll be twitching and evidence that the cow can feel it. There's often what we call scoliosis of the vertebral column. Sometimes it's quite apparent, sometimes not quite so. But because we've relaxed all these muscles here, and these ones on the other side are still contracting, the vertebral column tends to curve towards the side of the local anaesthetic block. So these muscles are relaxed and they are still contracting. So the vertebral column has a curve in it which can sometimes be visualised.